I think that's very interesting, and it's a new focus. I mean, I've been with the company for less than a year, but even in that time, that is something new that we are focusing more on, because I think for the longest time, I mean, parity is not new, right? I mean, parity has been around for a long time, but I think for the longest time, people were kind of able to more or less ignore, especially things like non-quantitative limits of care, or treatment limits in QTLs, and just kind of skate by, not paying attention to that particular portion of parity. And I mean, just very briefly to explain what that is quantitative limits would be something like, if you say you can only have so many therapy sessions, per month, that would be, limiting the quantity of the service that you can have. A non-quantitative one would be things such as, you must fail this therapy before you can get this other therapy, or certain things that are not obvious, like, not having enough psychiatrists in your network. So, even if the person needs the care, they can't get it. I mean, the care is limited by the absence of the providers to deliver that service. And I think for the longest time, this was kind of in the back burner. It was already the law of the land, but people were not focusing on it. And, it's what's hot now, because the federal government has decided to start enforcing those. And I think a lot of people are kind of panicking about it because they hadn't been thinking about it. And I think that's something that our guidelines, we are trying to give that focus through our guidelines to provide guidance on what constitutes a non-quantitative treatment limitation, and how and also to eliminate that from our guidelines, because that's the other advantage we do. We don't do just behavioral health, right? I mean, we do the inpatient, the surgical, we do ambulatory care, and so we actually get to compare across all of our content to make sure that, if we have a limitation in behavioral health, that's not something that's exclusive to behavioral health. That's actually present in all of our other contents, because that's something you can't do. You can't have limitations, say, for mental health substance abuse treatment. They are not substantially equivalent to the limitations that you have for medical care. And so since we do it all, we get to compare our own content and make sure that the limitations are present, everything. So you're not violating by being more restrictive with behavioral health than you are with medical. And so I think that's one way that we help. And also we've actually been going through our guidelines to make sure that we don't have anything like that. And we actually have been plucking out certain criteria that we used to have, but that now we're thinking, this is probably an NQTL, and we shouldn't have that.